Good afternoon. This is Barbara Brandt, Director of the National Center for Interprofessional Practice and Education, and I'm welcoming you to the second in the series of Connecting at the Nexus COVID-19 edition. This is a follow-up, this seminar, this webinar, to Monday's Creighton University's discussion about their journey of taking their IPE program online. It's called Transitioning to Online IPE in a Pandemic. Next. I want to welcome you on behalf of my colleague Gail Jensen, who is the current chair of the American Interprofessional Health Collaborative. This is a membership organization with the National Center. So we're pleased to present this series to you, which we kicked off on Monday. It is a series of web-based discussions, webinars, and forums to foster conversation and learning and resource sharing among leaders in the interprofessional practice and education field. Sessions will be recorded and they are archived at nexusipe.org. So you can access them and the resources that accompany them at any time. So today's presenters are Mandy Kirkpatrick, who is a Macy Faculty Scholar in the current class, Assistant Professor of Nursing at Creighton University. She's going to be presenting her model for virtual interprofessional simulations and is joined by her colleague, Katie Packard, who is a pharmacy faculty member and co-director for the Creighton IPE Passport program. So I will turn it over to our presenters.
Thank you, Barbara. So this is Mandy Kirkpatrick, and today we are going to be exploring a couple of learning objectives with you all. We want to look at how to transition your current case-based interprofessional education experiences to virtual interprofessional simulations, or what we call vision. We're going to share some tools with you for development and evaluation of vision experiences. And we're going to talk through several contingency options that might be considered to adapt when unexpected barriers arise, especially during an evolving pandemic situation. Next slide. There are many reasons why virtual interprofessional simulation can be used and should be used. During this pandemic specifically, it becomes necessary as many faculty and learners have limited access to clinical sites and on-campus resources like simulation labs. Institutions who have distance learning cohorts, like Creighton University, are accustomed to adapting IPE for virtual environment as we work with distance students across the nation in several of our health sciences programs. Some accreditors do require that these distance or virtual experiences are synchronous activities that engage more meaningful interaction. And while there's no signature pedagogical approach for interprofessional learning experiences, there's an article by McCutcheon et al. That describes several successful, authentic, and synchronous models for nurturing high-functioning teams. And these include collaborative online learning, case-based IPE, and interprofessional simulation. And with virtual interprofessional simulation, or vision, we combine all three of these approaches into one learning experience. Next slide. In order to be successful in implementing vision, it's important that we recognize its barriers or limitations so that we can plan for and leverage them. There are a number of logistical challenges that are faced when working with various distance learners from across the nation. Scheduling conflicts between programs, time zone issues, difficulty achieving authenticity in an online environment. Fiscal and technology limitations may be an issue. In pairing learners from different disciplines, there may be a developmental stage mismatch, such as first-year students from one program working with second or third-year students from another program. Programs with varying enrollment numbers may also be an issue, where you have student cohorts from one discipline that has, for example, 50 students, and you're trying to pair them with a disciplinary cohort from another program that has 100 students or more. And we can't forget about the limitations on faculty resources, workload, and buy-in. Students may also have a misperception that learning online is easier and that online students are somehow lazy or lesser, which hopefully now they're quickly learning that that's not the case. Next slide. So in contrast to these barriers, there are some benefits to mixing more novice learners with advanced learners, including opportunities for mentorship, which is a reciprocal and mutually beneficial relationship. Online simulation can occur anywhere. Many of us are working from home, but learners who are still working in a clinical setting or engaged in clinical experiences, this simulation can travel with them. If you look at these pictures here, you see an image of a student who's participating in our simulation from her car right before a clinical shift. You see a medical student who's participating from an on-call room. And then of course, students who are participating from the basement of her parents' home or from a dormitory room. Providing synchronous virtual activities for distance learners assists students in feeling more connected to their peers and to the university, especially during this time when many of us are feeling so isolated. Vision also allows for collaboration and learner participation from different institutions, which assists in overcoming those missing professions or those unbalanced ratios that I mentioned in the last slide. And of course, we can't forget the need for faculty scholarship. There's now a growing need and desire for virtual learning that is evidence-based. So developing, employing, and evaluating student outcomes with these techniques is a way that faculty can get involved in scholarship and that we can promote their buy-in. Dr. Packard is now going to talk about the various vision strategies that we wanted to address in this seminar and how they can be implemented. Next slide.
So we have characterized 3 different vision methodologies for the purposes of this webinar. The first of which is asynchronous simulation. And an example of that would be paper or video cases with some sort of asynchronous team discussion. There is modified synchronous simulation, and an example would be paper or video cases with synchronous team discussion. And then finally, synchronous simulation. And an example of this would be team rounds with a standardized patient. Next slide. So the first we're going to talk about is asynchronous simulation. And the example of this is paper or video cases with assessment. That would be one example. And at the end of this webinar today, we are going to provide you with a list of interprofessional education case repositories so that you have some resources for cases. But as an example, in our curriculum, we used a pre-recorded case in our introductory course, which is IPE 500. It's Introduction to Collaborative Care, and it's a course that all of our disciplines take. It's an online self-paced course. The case we're going to show you in just a moment is intended to teach the roles and responsibilities component of the IPEC core competencies. The students watch this case at their own, on their own time or their own schedule, and then we assess them with a multiple choice quiz that's assessing their perceptions of roles and responsibilities. The first snippet we're going to show right now is the beginning of the case, where first responders are arriving to assess a patient.
Okay, Mr. Allen, what they're going to do is they're going to apply this monitor to your wife, and it's going to check her heart rate and her
Very good.
vital signs, and then we'll...
The next section we're going to show you is when this patient is transferred to the hospital, and there's going to be a handoff and then a pre-brief prior to them entering the patient's room.
All right, I'd like to go over all of the new admissions on the unit. Is that okay? Okay.
Very good. And then the third snippet we're going to show you is when the team is rounding and completing discharge planning. And as you can see in here, we added a dental component to integrate our dental students as well.
It seems like I have a sore in my mouth here, and like inside my cheek or maybe like on my gums there. It just seems like it hurts in there. Okay. Are you the right person to talk to about that?
Well,
Thank you. So sometimes you have to be creative in making sure you integrate all of the professions that are represented at your institution, but we've been able to do that for most of our cases when needed. The next type of simulation we'll talk about is modified synchronous simulation. And an example of modified synchronous simulation is paper or video cases with some sort of synchronous team discussion. And before we do these types of cases, we'd like to bring all of the participants to a level playing field because they might come from different experiences, different backgrounds, or they might be at different levels in their curriculum. So we introduce them to some pre-activity tools to teach them to work collaboratively. And this includes the interprofessional team reasoning framework, which I'm going to review in just a moment. But this is an algorithm. It's very simple to teach students how to approach a case, something very second nature to us being, providers and practitioners, but for students, sometimes that's challenging. We also show them poor and exemplar videos, and then we give them some sample cases to work up, and we provide on the website, I'm going to have them click on this website for you to see, just to show you a little bit, but we provide faculty with example cases and some pre-brief scripts and also some post-brief scripts as well. We'll see if the link to this website shows, but we can provide you with this link. It's also embedded within the slides. There at the top is our CICE tool, which I'll talk about, but that's our assessment tool for which it's free and you can have access as well. If you scroll down a little bit more, you'll see the resources for the interprofessional team reasoning framework. Right there. So that is available, just clicking on the link. And then of course we have our cases and our exemplar and not so exemplar videos as well. So we just want to make you aware of those resources. Thank you. All right, and this is when you click on the interprofessional education team reasoning framework, this is what you'll see. This algorithm depicts the framework, which is a guide to teach students how to approach a case in a collaborative manner. It was developed by faculty at Creighton University, but it's actually framed off the World Health Organization ICF model, which some of you are probably very familiar with. And it provides a really holistic way to assess patients, to identify not only the priorities of the various team members, but to also emphasize the patient as part of an integral part of the team, especially the patient's priorities. And it provides a framework for balancing those priorities because sometimes they conflict, right? Sometimes the patient's priority is quality of life, whereas, some of the clinician's priority might be a mortality benefit. So it really helps the team to work out and decide how to prioritize those needs. Next slide. So simple cases. Simple cases are an activity that we do in our pharmacy and some of our prescribing disciplines in a student ratio of 1-to-1. And it's a very simple 10-minute activity that we do online. And at the bottom of this slide, you can kind of see a snippet of what I like to call the grid, but this is how I organize all of my online activities. In this example, there are 3 moderators, but we can run as many as, unlimited amount of moderators as long as you can get that many faculty to serve as a moderator. But under where it says moderator, we would plug in the Zoom or the WebEx link for that particular room, and students' names would be put into the grid and they're told which case they're going to be doing and at which time slot. So again, it's in a 1-to-1 ratio, and these cases really introduce the concept of interdependency. So we design these cases such that, for example, the prescriber knows the type of the infection that the patient has, but the pharmacist knows about the allergy that the patients have. So there is interdependency. They have to communicate together in order to find the best plan for the patient. So it teaches roles, responsibilities, communication, and teamwork. Next slide. And the components of the simple cases are really a moderator script. We provide very clear and succinct scripts for the moderators. We provide them with Zoom or WebEx settings, telling them if they need to use the waiting room function or if they are to leave the students alone. We provide, there's a different copy that the prescribing student gets versus the pharmacy student. And then we also provide the moderator with the clinical answer, which they are instructed to read and discuss with the students after a certain time period. But we're going to discuss assessment in a moment and how we do that. But know that these students, for these introductory simple cases, we only assess them on their interprofessional interaction and not necessarily their clinical plan. We learned after piloting this for some time that students found it stressful to have to worry about how they're going to interact with another healthcare provider for the very first time, and then also worried if they're going to get the right clinical answer. And it's also challenging for monitors to assess for both, because sometimes you need two different rubrics. So we try to keep it simple and only assess on the interprofessional interaction. Next slide. So building on the simple cases, we also have complex cases, which students do after they complete the simple cases. And this isn't an interaction between a pharmacy student and a prescribing student, but again, you can modify these cases to include any discipline that you need. This happens to be in a 1-to-1 ratio, but you can certainly have more students in the case. And this one's over 20 minutes. And this introduces the concept of patient-centeredness. So for the particular case we use, we have a patient that is a server at a restaurant, and her schedule is such that she skips meals, and she also happens to have diabetes. And so we want to cue in the students to knowing that a certain class of medications, sulfonylurea, would be inappropriate for this patient because of the potential for low blood sugar. And these cases reinforce roles, responsibilities, communication, and teamwork. Next slide. So again, we provide the moderators a very clear script. Right now, in light of this pandemic, we are, like everyone, kind of scrambling to create some of these activities and replace a lot of our clinical and community engagement activities with online Zoom-based activities. And so we are recruiting moderators with very limited or no moderating experience. They may not have done this before. So by using very clear scripts for your moderators, that eases some of their anxiety, and they're going to be much more willing to volunteer to help you with this. Next slide. For these activities, the students are provided with the same patient chart. They have the same active information, just because the goal for this particular case is patient-centeredness. Next slide. And moderators then read and discuss the clinical answer to the case, and they answer any questions that the students may have. Students are then provided verbal feedback about their interprofessional education interaction. And we use the CICE tool to do that, which I'll talk about in just a moment. And then they are also provided a paper copy of the completed CICE as well. Next slide. So what is the CICE? The CICE is the Creighton Interprofessional Collaboration Evaluation Tool. And it is a free assessment tool, and it is available online. We already showed you the link previously. It's that same link with other tools. But it is very easy to access. We do require you to watch some online training videos, which are very brief. They're quick, they are self-paced, and they are free. And once you watch the videos, anyone can access this tool. On the slide here, we just have a little snippet of the tool, but it's based off the IPEC core competencies. And note that it's a little bit more comprehensive than what you see on the screen. The nice thing about this tool is it can be customized for any activity. So if you don't, for example, do a debrief, or if you don't have an ethical scenario, then you can remove those components and customize the grade. And now I'm going to hand it back to Mandy to talk about synchronous simulation.
All right, thanks, Katie. So I just want to point out for anyone who does not have the chat box open that the links that we're talking about or referencing are posted there. Angela Wilson has posted those for us, so thank you. You should be able to access those directly there. I also did see a question. We'll address, of course, some questions at the end, but there was a question about the use of virtual reality. And so we should clarify that what we are talking about here today is virtual simulation, and that it's online simulation, but we don't actually use virtual reality. We are working with standardized patients. So we believe that it's a more authentic, realistic experience that way, but that's not to say that virtual reality and the use of avatars does not have a place in online learning and isn't very valuable, because it is. But we do know that sometimes that can be cost prohibitive. Use of standardized patients can also be cost prohibitive. So we'll have some time here to discuss some sharing of ideas and how we can address some of those things. So the example of synchronous simulation I'm going to share with you is a palliative care simulation that I developed with a faculty and interprofessional faculty team around palliative care. We actually do these simulations in 2 phases. So we have one simulation that is a palliative care simulation in the acute care hospital setting. And then the phase 2 simulation is a hospice simulation in a home hospice setting. And we use the same patient in phase 1 and phase 2. Phase 2 is just further down in her illness trajectory. It provides some consistency in using that same case. It's the same students that participate in both simulations at midterm with phase 1 and at the before finals for phase 2. And the way that we schedule these, because they do need to be synchronous and we do have to overcome program schedule issues where not everyone is in class or clinical at the same time or has time free. So I use a doodle poll in order to assess when students are available, and we schedule it that way. We schedule them in teams. We want to make sure that there's equal representation on these teams from each profession. And the simulations are an hour and a half each. And so we're trying, we think that's a short enough time where we're being respectful, but also making it a robust experience for the students. So before students arrive to their scheduled simulation, and by arrive, I mean that they log in on Zoom just as we are right now, we have them complete a pre-simulation module. So they get into our learning management system where they can access the resources. And this is self-directed preparation. So they can access this simulation module anytime within the weeks preceding the simulation. And then the plan for the plan for that simulation itself is made transparent to students, because they don't really, maybe they've done simulation in a lab setting, but doing it in online is just so unknown, and they already get quite anxious about simulation. So by laying out the plan and saying this is what the expectations are, and this is what the simulation, is how it's going to work, what it's going to look like, really helps to put their minds at ease. And then we do hire standardized patients who then are provided scripts, and we train them on the use of the Zoom technology in order for them to participate. And then our assessment and feedback for the students is done using the CICE instrument post-simulation. That's the instrument that Katie was speaking about. Next slide. So here I'm just we'll just click through. These are just some examples of some of the things that are in that pre-simulation module for the students to access. So you can see that it's got H&P, their admit notes on day 1 and day 3, an advanced directives document. And there's even a brief prequel video. We use the prequel video to kind of set the stage for the case. It shows the nurse talking with the hospitalist team about Hazel, who is our patient in this case, and about, they sort of identify at that time the need for a palliative care consultation. And then our interprofessional student team is actually going to be the team that conducts the palliative care consult during the simulation. So this just prepares, by watching the prequel and reviewing these documents, it prepares the students to act as the palliative care team in the simulation. Next slide. And then this just shows that phase 1 plan. As I said, it's important to show the students sort of putting their minds at ease what can be expected. And so this just lays out how we run the simulation. And so we spend, as I mentioned, it's an hour and a half simulation. So we spend the first 20 minutes, the students all have their cameras open. They open their microphones as each of them contributes. And they really just sort of deliberate about the case. They say, in reviewing Hazel's chart, this is my perspective as the physical therapist. This is my perspective as the occupational therapist, the nurse, the social worker, pharmacy, medicine. We have actually 7 different health professions that participate in these simulations. And they talk about what they feel like the priorities are for the patient, and they establish a plan for the interview. They know that they're going to be identifying team members who are going to engage with the standardized patients after the end of their case discussion. So they'll identify usually 2 of their team members to conduct the patient interview, which is a goals of care discussion. They should recognize that the advance directive is outdated, that there needs to be some discussion about that, as well as some discussion about what Hazel's wishes are and an understanding of kind of where she's at in terms of understanding of her illness. So then that next 30 minutes, once the team has identified who is going to engage in that interview, all students who are not going to be participating in the interview do close their cameras and turn off their microphones, but they still watch the simulation. So they're still observing their team members who are engaging with the standardized patients. And then we have the standardized patients open their camera at that point. And as you can see, we actually have the standardized patients in a simulation room so that it looks, we try to make it look realistic, look like the patient is in the hospital with her son. However, if you don't have access to a, simulation lab right now to be able to do this, certainly the standardized patients can be from home, and we can just explain away the fact that, although the background is in a realistic hospital setting, the standardized patients are performing in those roles. Once that patient interview concludes, the team gets back together. So we have the standardized patient close their camera, and all of the students open their cameras and their microphones again. And they have some discussion about what they learned in that goals of care discussion so that they can develop a palliative care consult note. So what they're doing is trying to come up with recommendations for the primary care team based on that discussion that they had. And then we all together debrief about the experience. So the faculty facilitates that debriefing with all of the students. We don't have the standardized patients participate in the debriefing, but I do know that in some simulation settings, standardized patients will either participate in debriefing or perhaps give some feedback to the faculty facilitator that can be shared during a debriefing. So those are things to consider. And then we're looking at the phase 2 simulation, which is that hospice setting. So in the hospice simulation, again, we share the resources in a pre-simulation module, just as we did with the phase 1. There's a prequel video, and I just want to show a brief snippet of this prequel video so you can see what it is that I'm talking about. So when this video gets pulled up, you'll see that there's sort of some scrolling text that precedes the actual start of the video. And in that scrolling text, it just gives a little bit of background about, what's sort of happened with Hazel since the phase 1 simulation. It says, that Hazel's had multiple admissions to the hospital since she was discharged previously, that she's further along in her illness trajectory, and is now at the outpatient palliative care clinic talking with her palliative care provider. This is the wrong video, but that's okay. Oh, there it is.
Patient is an 80-year-old Hazel Smith. She was admitted 3 days ago when her son brought her into the emergency.
Phase 1. The phase 2 will show more of like a clinic setting, so you can see that here.
Hi, Mrs. Smith. It's so nice to see you today.
Hi.
I see that you're in a wheelchair. Have you been having problems walking?
It's their pre-simulation module, so they are able to watch this prior to coming to the simulation. Helps to make it a little more realistic and sets the stage for the students. Although, having these prequel videos is nice, it's really not necessary. Most of the information that's provided in the prequel video is also provided in the chart in the pre-simulation module. And then we do have a statement that we post that's specific to the hospital simulation. In order to establish psychological safety for the students, we want them to recognize that likely that the standardized patient in the simulation will die by the end of the scenario. And that there may be some emotional distress that students might face. And so we provide them with a list of resources, both in the syllabus for the course as well as within the module, in case they do have some difficulties with coping with that. And then moving on. So this is the phase 2 plan. Oh, previous slide, please. Yeah, so this just lays out what that phase 2 plan looks like. where the phase 1 simulation was a palliative and inpatient palliative care team. In this simulation, we tell the students that they are actually the hospice care team that is going to be setting up the home care, the home hospice care for Hazel. And so the team spends the first 20 to 30 minutes coordinating those services, talking about what Hazel might need in the home in order to prepare for the end of life and to prepare her family for the end of life. And then we do a time lapse. So we say, okay, now you've established this hospice home care plan. Now we're going to imagine that this plan that you've created has been in place for 2 weeks, and you're going to send 2 of your team members on a home visit to talk with Hazel's son and his wife, who are the caregivers, and that Hazel is now at a point where she can no longer communicate. So instead, the team members are communicating with with Hazel's son, Bradley, and his wife. So we'll go ahead and just show you a little bit of that video so you can see what the simulation looks like. And I did get permission, by the way, for all videos and images of students to share with you all.
Around or something.
Completely understandable, and would just love to reiterate again what Darren mentioned, that if that ever changes and you do need that additional support, like if you needed to take a break to go to the grocery store or to take a nap or, go see a friend, that is completely okay. And we have people that would come and sit with her and give her that company, kind of like what you mentioned you enjoy having for her.
Okay, thank you very much.
We don't need it now, I don't think. But
we're doing good.
All right. Is there anything else that we can help set up for you or answer for you? Any confusion on anything?
I think you answered all our questions, and I feel pretty happy about it.
how do we know when it's, I can't go to the words.
I think we'll know.
When it's getting near the end. Sorry.
That's okay.
How will we know?
Definitely, it's kind of like Brad was saying, you'll definitely see a change in her, and you'll know when it's getting to be time. And I know she's not super responsive now, but when it gets very close to the end, she'll become even less responsive, and her breathing will kind of slow down and become more shallow, and it'll kind of sound a little rattly, like it's down in her chest. And
program, and Darian is a nursing student. And then you can see the standardized patients there that we have sitting in a conference room that's made to look like they're sitting at the dining room table and communicating. And so if, anyone questions sort of the authenticity of, really how realistic is this, you can see that with this particular simulation, the students get really engaged and really involved, and it does feel like an authentic, like you're really speaking with a patient or a patient's family and providing that caregiver support. One thing I didn't mention is that this is actually part of an elective course, an interprofessional palliative care elective. So the students
Mandy, this is Angela. I'm not sure if you can hear me, but your sound just cut out.
It sounds like she might have gotten taken off. This is Katie Packard, and I can take over from here. Maybe she might need to reboot or leave and come back in. Mandy, can you hear me? Well, I will just continue, and then maybe Mandy can leave and come back in. Sometimes that helps, or if she briefly lost internet access at home. But I think what she was saying is that this is part of a palliative care elective, but these components could be broken down into smaller pieces and certainly used as interprofessional activities to replace other ones that you might have been able to cancel because of COVID issues. So next slide. All right, so the debriefing questions. So some of the strengths that they ask, so they ask the students what went well, did you feel like a team, were all voices and roles integrated, and then weaknesses or improvements that they gather through some of these debrief questions, or what do you feel your team could have done better, or what are some missed opportunities. And I know she has circled on here a few examples that we like to do some reteaching to the students so that they know like not to have their pets if possible in the camera, or I think Mandy was also doing some other activity while she was moderating as well. So just a really great example of teaching, appropriate online etiquette and to make sure that all the students are engaged. So I think some of that is captured in the debriefing session. Next slide. All right, so how to adapt a plan A to B to C to D, and we've had to do a lot of this lately because of I'm kind of sick of hearing the word fluid, as I'm sure many of you are, but the situation is very fluid and things change on a daily basis, and maybe only one activity is canceled and the next day all clinical activities are canceled. So we've had to have many different plans, but for example, plan A is I planned for an on-campus interprofessional simulation, but our programs have now moved to 100% online. What can we do? And so one of the examples, of course, would be to turn your interprofessional simulation to an online simulation using some sort of platform such as Zoom or WebEx. And I just got a text from Mandy that she's going to be calling in soon. So hopefully if you see a phone number there calling in, we can let her back in. Plan B is that she planned for a synchronous virtual interprofessional simulation, but can no longer use standardized patients or have access to the simulation lab. This is something we encountered in some of our activities because our standardized patients, many of them are retired or in that age group such that they are not leaving their homes these days. So, and some of them don't have access to Zoom or may not have the skills to access or Zoom. So some of the things we've done to recruit standardized patients is we've used some students that have lost their clinical hours and they need clinical hours. So we've helped them, have them help us develop some of these cases, and maybe they can act as the standardized patient. So these might be some end of the curriculum students that are on their experiential education. So we've done a lot of creative things to find standardized patients. Plan C is
sorry, I'm back. It's
great.
Me.
Yay.
Sorry.
I took over on Plan C.
Yeah, no, you're doing great. You're doing great. The only other thing I was going to add to that is that, if that's not an option, if you have a video recording, so this is where you might even flip to a video case or a recording of a previous simulation. So you could have the students still engage in that case discussion, but then also, during the time when they would be engaging with the standardized patients, you could show a recording of team members participating in that discussion. So that's just another idea. And I would welcome anybody who's on the chat and you have ideas for these contingency plans, maybe experience that you've had with these various options, that you go ahead and type some of those into the box, because it's really, we know we're sharing our experiences, but we know that there's probably many of you out there who have a variety of experiences and a wealth of knowledge to share as well. So I guess I would just, if you're doing Plan B, kind of ask yourself, can you find a different video case if you don't have a recording of the simulation that could be used and adapted to meet the same learning objectives? And then that takes you to Plan C, which is, I planned to use a video case with synchronous discussion and debriefing, but I can no longer connect synchronously. So then, you might consider, okay, well, we still have the video case, we still have the recording to provide to the students. If they can't connect synchronously because the schedule is no longer aligned, or we don't have the technology, if my internet is cutting out and I can't do this synchronously, I'm getting booted out of Zoom, then you might make sure that you've got like a backup plan set for maybe a discussion board where the students can do either a discussion board or a live chat One great and interactive way to do a discussion board, although it's an asynchronous option, you can make it feel more synchronous by having students actually do a recording of their responses. We actually do this in the course to prepare for their synchronous simulation. We have a discussion board a couple weeks before the live simulation where we have them look at a different case and we have them record themselves responding and sharing what their plan would be from their professional role for that case. And so they do a brief 2-minute recording and they post that in the discussion board, and then they respond to each other's posts. You know, they can either do an additional recording to respond or they can type that in. Katie, did you have anything to add to that particular plan?
No, I think, you know, our plan for Plan D would be, and you mentioned this, but just like using that record function in Zoom or WebEx, just record all of your interactions, such that if you have someone that loses that connectivity, like we just, and that wasn't a planned thing, that, but if you do have someone that loses connectivity, it's recorded, and then you can assign the student something else. Okay, well, listen to the recording and answer, you know, these debrief questions, or maybe you and the student will meet one-on-one to discuss something. So record is a good option for when we all have unstable internet connections right now.
Yes, absolutely. I think that's a really great backup plan, especially you know, if you're trying to carry out a synchronous simulation, but you're just not sure about that connection, just having the record. But that actually transitions really well to this reminder here. Don't forget, pre-briefing and debriefing are as important as the simulation itself. If you're not familiar with simulation or the literature out there, there's an international society for nursing and health professional simulation that sets forth specific guidelines for simulation. So the acronym is INAXL. If you go out and you look at the INAXL website, you'll see that there's a number of very specific guidelines for simulation. And the literature out there really speaks to the importance of pre-briefing in establishing that psychological safety, making sure that the students know that, hey, you will see the little record button in the top left-hand corner. Here's why we're recording the simulation, so that they know why you're recording, what it might be used for, so that they understand that. If you're going to be evaluating the students, depending on the objectives of the simulation, if it's going to be used as part of their course grade, they definitely will need to be made aware of that, and that should be part of that pre-briefing. Letting them know if you will be evaluating them, what are the objectives they're being evaluated on? What does that evaluation look like? How will they receive their feedback? And then the other thing to consider with the pre-briefing is sort of setting the stage, the parameters around the simulation, that you want it to be as realistic as possible, that you ask the students not to discuss the simulation outside of their simulation group, that the things that are said or done within the simulation should remain within that simulation space. It's supposed to be a safe space for everyone to participate. And then maybe some information about the technology that you're using. You know, if you're not talking, we're asking you to mute your microphones. You know, there are certain points in the simulation where we're going to ask you to open your video. Make sure that you're in a quiet space and that you won't be interrupted by children, that you won't be interrupted by pets in the room. There were some pictures on the previous slide. When I got booted out of the room, there were some pictures on that slide that showed that when I didn't do that, we had a cat that was climbing all over a student in the Zoom video, and it was pretty distracting. Making sure that they mute or turn off their cell phones so their cell phones aren't ringing. Those are just some other things that you'll want to establish in the pre-briefing. And then looking at the debriefing portion, there's different ways to do debriefing. And if you're not trained in debriefing, you might go out there and look to educate yourself on it. But generally for the debriefing of the simulations, that synchronous simulations that I use, we talk about strengths and weaknesses. We have the students look at the IPEC competencies and evaluate whether or not we've met the objectives of the simulation. So all of that becomes a part of the debriefing. And as faculty, we guide that facilitation. The students provide each other with feedback. They talk about how they felt about the experience. And then as faculty, we also give some contribution to that as well. And what's really nice with the palliative care simulations is we have chaplains participating. So they get that sort of support from the chaplains as well. And Katie, you have any other additional thoughts? I'm just looking at some of these.
No, I think they want to get to some Q&A real quick, so we might want to kind of wrap things up.
Yeah. Sure.
Yeah, go
so
ahead.
Just these for tips for success, you've got the link to the Nexus website, which does provide, there's a planning worksheet on there. On the second page of that planning worksheet, it gives more details about tips to success, but, and really how to design your own or how to adapt one to meet your own learning objectives. So we can go ahead and move on from this slide. And then here's some case repositories where you might, while it's great to develop your own, you don't always need to. There's a lot of cases out there on the web. So you can see here's some websites that we're providing to you as resources. All right, we'll go to the Q&A portion.
Are you ready for the questions, which I've been monitoring? And they're quite plentiful. So the first question that came in was, should they seek approval from you to use the cases within their classes?
The ones that are on that website, you do not need permission, so feel free to use anything on the website. The only thing we ask is if you use the CICE assessment tool, you'll have to register your credentials and watch the training videos and make sure you know how to use it. But those other resources are free for use.
So this is an example of the service that we provide on nexusipe.org. And encourage people to upload their resources they want to share. We do track it and can get you metrics on their use. Let me go to another question. Our dean has requested a proposal for a virtual reality company platform to replace some of our clinical experiences. Do you have any that you would recommend? And I think you should you already made some distinctions between this work and virtual reality, but go ahead.
I do not. Mandy, do you?
So while I don't have plans to, I've been exploring ways that we could do this with virtual reality because there are the limitations there with standardized patients. And, right now there were some questions in the box about, what do you do now? Because you can't get on campus. So standardized patients might not have training on use of Zoom. And so virtual reality would be a great way to do that. I'm not familiar with a platform for doing like a multiplayer room where there's not already pre-programmed responses. So it makes it a little more challenging. But I am interested in if there's anybody out there who is aware of a platform for that, please do share in the chat box. But I have not located one yet. So that's something that I'm going to continue to explore as part of my project. But the other thing that I've been speaking with our IT department with at Creighton is, okay, if we don't use avatars and we don't have standardized patients, is there another way where we can make students or faculty look like not themselves? And their idea was to use a Snapchat filter. So you could still, carry these simulations out in a way where you can use a Snapchat filter to make someone look older or younger than themselves or look a little different, just so that it feels like a little more realistic and not like you're talking to a faculty member or a student that you're already familiar with and know.
That's a great idea, Mandy. We're having some of our residents use baby powder or dry shampoo in their hair to make them look a little bit older for some of our sims. So there's another low-tech idea.
Okay. Some of us don't need that. Another question is, can you elaborate on student behavior and participation expectations?
Yes, so that's another resource that we've got posted for you on Nexus. It's labeled as, I believe, example of vision pre-briefing. And in there, it specifically talks about the fact that we want students to conduct as if they were in a real clinical environment. So we talked to that, it addresses the fact that they should be dressed professionally, they should be dressed for their professional role. They should be taking this as an opportunity to learn in as realistic an environment as possible. So really kind of personifying that role that they're doing. And those expectations, there's some other examples there of things that we want we want them to dress in a professional, there's a listing of 7 different things that we require. We require that they come prepared, that they've got reliable Wi-Fi. I suppose I should set an example of that. Free from extraneous noise and distractions, that they conduct themselves as if they were in the clinical setting, that they treat each other, the faculty, and standardized patients respectfully, and then just actively participating throughout the experience, or that they might, if they miss the simulation or they don't readily engage, that they may have a makeup simulation or a makeup exercise, which what we've done is use the recording and had students watch the recording and do an evaluation of the interactions that they saw in the recording, and provided that as the alternate experience for those. We don't tell them that ahead of time, but it's inevitable. Sometimes things come up. We had a medical student who was in the middle of delivering a baby and she couldn't stop for the simulation. So we made sure to share with her the recording of the simulation, and then she kind of weighed in on how she thought her peer group did, and did a reflection on that.
Wow. Boy, we're getting lots of questions. I'm wondering if you could stay on a few more minutes, so those who would want to have their questions answered, we can get through them. If not, we can answer them after the fact. So I'm going to get to the next one, which is, who leads the debrief? Do you ever let the students lead?
So we've had faculty and chaplains facilitating. We have co-facilitators for our simulations. I attended CAB in the fall, and there was a session that really emphasized that when you're doing an interprofessional activity, having interprofessional facilitators of the activities is really important. So I've kind of taken that to heart. So we make sure we have at least 2 interprofessional faculty and/or a faculty and a chaplain lead those debriefs. I don't have experience with students leading debriefing, but that's an outstanding idea. Katie, do you have any experience with that?
I do not. No, we've used the moderators, and then sometimes for our ethics cases, we give several of our ethics faculty members that teach ethics from different disciplines, and they'll guide through some larger group debriefings. But no, we haven't flipped it and had the students lead, but that's a fantastic idea.
So we have 2 questions on standardized patients. What do you do if your city is in lockdown? How do you use standardized patients? And you sort of alluded to that, but are these standardized patients volunteering their time, or how are payments arrangements made?
Well, prior to COVID, our university has a repository of standardized patients. It's run through the medical school. And so we've typically used them, but they come to campus. So even if they are working through Zoom or WebEx, they come to campus and we get them set up on a laptop on campus. Since COVID, we've been unable to use these individuals because they've never been trained to do remote acting as a standardized patient. So we've had to be somewhat innovative, as mentioned. So we're using faculty. I've recruited staff members. There are a lot of staff members working from home now that have more time available because of COVID. So we are also using students that are on clinicals. We were exploring other, individuals that might be out of work right now, people in the food industry and so forth. I looked into that, but the paperwork was going to be very, very time consuming for me. It would be probably at least a half hour to an hour per individual running it through the university. So I ran into too much red tape to use lay individuals. So we're looking internally through existing staff, faculty, and students. But I saw that someone posted on a link to individuals that are standardized patients that are working from home on the chat. So that I think I'll look into that as well.
That's great.
Yeah.
We have a question taking a little bit of a different turn. I'm interested in, it says, great examples, thank you. I'm interested in the resources and follow-up for psychological safety. How do you handle the situations in which individual students have strong emotional reactions to the simulation?
So I've only had one case where a student had, so I'll admit I have limited experience with that. We have one student that got a little tearful, but she maintained composure, and then I stayed on the debriefing after the fact, and we had some discussion about that. And then she also wrote a reflection and sent an email to me to just check in, and I checked base with her periodically after. I'm fortunate though that I do have chaplains that are, chaplain students, interns, residents participating, and or actual chaplains participating in the simulations at this point. So they are very helpful resources during the debriefing sessions.
Someone has asked about your team, your development team. Do you have instructional designers, IT support, or is this fully faculty driven?
Go ahead, Mandy.
Oh, I was just going to say for the palliative care simulation, it's fully, it's faculty driven with the exception of the recordings. We have a Phil, our video guy, who assists with doing the recordings and helps us getting those online.
Our Center for Interprofessional Education and Research does have an instructional designer assigned to our center, so we can utilize that, and we do for many of these activities. And also when we're developing cases, for example, I'm a pharmacist by background, and I'm doing a good job of putting pharmacy, components into the case, but I often need help to throw something in there that might be more dental related or EMS. We have a interprofessional education curriculum committee that meets once a month. And so anytime we need to build an IPE case, we will slide it into that curriculum committee meeting, and we'll take about 5 to 10 minutes and we'll talk about the case, and everyone will throw in some ideas that represents their respective discipline. So that's how we utilize that committee to help us to develop some of these cases to make sure all the disciplines are represented.
So I'm looking through some of the other questions that are coming in, and actually people are recommending resources, so we can get that out to you. It's actually quite a robust list that's starting.
Yes, thank you. I'm copying and pasting like crazy.
We will do that. We'll get it out to you with the follow-up, but there are quite a number of them here, which is excellent.
Yes, thank you to everyone who's posting those.
Yeah, it's wonderful. So we have one more question in the question and answer. Can you speak about your experience with the AAMC MedEd portal? I have also used EHR Go. And that'll be the last question we'll take, Sean.
Okay, EHR Go is a case repository. We use that in our pharmacy curriculum for pharmacy-specific cases, but it does have a lot of interprofessional cases built in as well, and you can create your own and save your own cases as well. The AAMC MedEd portal is a little more broad and robust. I've personally submitted a case there before. It's not a case database per se. It's different types of activities. So some of them are case-based, some are other types of learning. So they're kind of a different methodology. I would say EHR goes strictly more a case repository, whereas MedEd portal has different types of activities and publications.
So I'm going to wrap this up, and I have a few announcements afterwards, but questions came in. We do send you an email with links to the archive, one evaluations. We are looking for future webinars if people want to volunteer. And so you will be getting the information when we send out the archive. The next webinar will be on April the 7th, and I think that's Tuesday. I've asked our evaluator in the National Center, we're going to talk about what you could be documenting today to build a stronger IPE program. There are massive changes going on today, and we're going to recommend some easy ways for documentation because the changes are so huge that we know that it will strengthen IPE in the future. And then on Thursday, We have our Arizona State University colleagues will be talking about from our team to yours, strategies for successful remote teaming. And this is based on a blog that they sent out last week, and we asked them if they would do a webinar, and they volunteered. We're thrilled. And then we just lined up this morning, taking it statewide, online IPE and assessment in a pandemic from Indiana University, who has quickly put on a statewide IPE program, had to change their assessment strategies overnight, like many of you. So my last slide for you, and I think it's the last, is again, we're looking for recommendations and volunteers, but we are encouraging you to join the American Interprofessional Health Collaborative and really becoming a part of this community of practice. You'll also be getting that link with the email you'll be receiving from us. So I want to thank Katie and Mandy, a magnificent job. People were on fire. And thank you for sharing not just your expertise, but your resources. And we're just thrilled that you volunteered. So we look forward to hosting you next week and for future webinars. Thank you.
Thank you.